Welcome to Lesson 2.4 of the Montreal Cognitive Assessment MoCA course. In this lesson, we will focus exclusively on the memory domain, specifically the 5-word recall task, an essential and heavily weighted component of the MoCA. This domain tests delayed memory recall, a key area of cognitive function that often shows early signs of impairment in patients with conditions like Alzheimer's disease or other types of dementia. This lesson will guide you through the purpose, test procedure, common errors, scoring system, and clinical significance of the 5-word recall task. Purpose of the 5-word recall task. The 5-word recall portion evaluates episodic memory, the ability to store and retrieve information after a short delay. It helps identify short-term memory deficits, encoding problems, example, failure to register words, retrieval difficulties, example, forgetting despite initial learning. This task is designed to differentiate between normal aging and more pathological memory loss. The procedure. How the task is administered. The 5-word recall task includes 3 main steps. Step 1. Initial presentation, encoding phase. The examiner reads 5 unrelated words slowly at a rate of 1 word per second. The words are from different semantic categories to ensure variety. Example, face, velvet, church, daisy, red. After hearing all 5, the patient is asked to repeat them in any order. This is repeated twice to support the encoding process. Brain note. Repetition helps determine whether the patient is unable to remember due to lack of registration or true memory loss. Step 2. Delay period. After the 2 trials of learning, the test continues with other sections. Example, naming, attention. This introduces a short delay, about 5 minutes, during which no reminders of the 5 words are given. Step 3. Delayed recall. After the delay, the patient is asked to recall the 5 words without any cues. If the patient cannot recall all 5 words, category cues are provided. Example, it was a type of flower. If the patient still cannot recall, multiple choice options may be used as a final step. Only uncued recall counts toward the official score. Cues are diagnostic aids, but not scored. Scoring guidelines. Each correctly recalled word, without any cue, earns 1 point. Maximum score is 5 points. Cueing responses are not included in the MoCA total score, but can be used to analyze retrieval versus storage deficits. Let's break it down. Free recall is scored and contributes directly to the total score. Cued recall is not scored, but is useful for diagnosing retrieval versus storage impairments. Multiple choice recall is also not scored, but it offers further diagnostic insight. Interpretation and clinical relevance. A score of 4 to 5 is usually considered within the normal range, depending on age and education. Scores of 0 to 3 may suggest cognitive impairment, particularly in memory encoding or retrieval. Patients who improve significantly with cues likely have retrieval problems, as in depression. Patients who do not respond to cues may have true memory storage deficits, as in Alzheimer's disease. Common errors to watch for: not giving 2 learning trials. This compromises the validity of the test. Giving hints during learning. This skews the encoding phase. Scoring cued answers. Only spontaneous recall counts. Repeating words in a fixed order. This may influence recall by rhythm rather than memory. Lesson recap. In this lesson, you explored the 5-word recall task of the MoCA, a critical test of delayed episodic memory. You learned the administration steps, scoring rules, and how different recall responses can reveal underlying cognitive issues. Scoring is based only on free recall, and both encoding and retrieval patterns offer insight into the nature of any memory impairment. Understanding this section is essential for test administrators, as memory performance often signals some of the earliest signs of cognitive decline.